Okay, we're on. Welcome everyone who's watching this video to Mouth Breathing Awareness Month. My name is Sarah Hornsby and I'm here with Natalie Katers, and I am trying to get all of these amazing professionals that I know to share their stories on mouth breathing. So mouth breathing seems like something that none of us should care about. Why would it matter? But what we are learning is that if a child or an adult is mouth breathing, even if it's only during the night, this can be a sign of bigger underlying issues, and it can lead to bigger health problems down the road. So Natalie is actually a hygienist in Australia. So she lives in Melbourne, Australia, and she's a hygienist, and she is doing myofunctional therapy screenings in a dental practice where she works. So I would love for you to start off, Natalie. Why don't you tell us, like, how did you get into this, and then lead into kind of how your story started to unravel? I know we've talked about it a bit, but go for it.
Thank you. So I discovered myofunctional therapy. I actually signed up to a weekend course in Sydney in Australia. And at the time when I went to my first course, I was pregnant with my first son. And I'd actually just quit my job as a dental hygienist due to occupational pain, which I thought was occupational pain at the time. And I sat through this weekend course in myofunctional therapy thinking, oh my gosh, these people are talking about me. Maybe my occupational pain isn't just related to dental hygiene work. And I'd been doing dental hygiene for about 10 years at that time. So I had my first son, kind of put all of the myofunctional things in the back of my head, became a mum. I didn't really go back to work because I got pregnant again. And
really
when
quick,
I got...
where was your pain? Like, was it shoulder, neck?
So I had, neck, shoulder pain. It had run down my arms into my wrists, and I'd seen, a lot of specialists and been told various different things when it comes to, occupational pain, but nothing really made sense. And so I just thought I'll quit my job and become a mum. And then I signed up to do your course. One of my colleagues mentioned, hey, you should do this course with Sarah.
Aww,
I signed up to your course.
Yeah, I'm really glad you did.
It was great because you sent that book out about reading about airways. The dentist, and in the first chapter, he talked about his wife and how she was a really healthy person and she exercised, but she always had digestive issues and was always sick. And again, that light bulb moment, I thought, this is me. And I was pregnant again. So I went through your course online and I was pregnant. And as a mum, you kind of forget about yourself. And I thought, great, my children are not going to have myofunctional problems. And I had 2 babies. And after the birth of my second son, I just kept having this occupational pain, but I wasn't working. And so I was starting to think, hang on a minute, something's not right here. And I did go back to work. And then last year, I started getting awful headaches, like debilitating headaches. They would last for like 6 or 8 weeks. And I'd have to say to my poor kids, I'm sorry, Mummy just needs to lie on the couch. And I would lie on the couch and close my eyes and hold my head. And my poor kids would sit there tapping me. And I'd say, I'll be okay, I'll get up in a minute. And I asked my dentist at work if he could please check my splint, because it was at that stage I thought maybe something I'm doing in my sleep is giving me a headache.
Did you have any clues, like going through my course, did you start to connect any dots that maybe you had some of these myofunctional symptoms? Had that resonated yet?
Yeah, I started to, throughout your course, I thought I'll just easily put myself through my own program. So I started putting myself through the program that you taught us. And when I would get to the swallowing exercises, I just couldn't do them. I would really struggle. So I realized that I did have a posterior tongue tie, but my tongue didn't look like those typical pictures if you Google tongue tie. So I thought, I was just being over the top. And again, I put it in the too hard basket. But I did realize, like, I've always had a various splints over the years for teeth grinding, but they probably haven't been made correctly because, you know, as a dental hygienist, you take your own impressions, tell your boss you need a splint, and he sends it to the lab for you.
Yeah.
And it was just my headaches that I thought, oh, I better get this checked out. So my senior dentist at work, Dr. Kerry, I asked him to check my splint, and for the first time in my career, I actually had a dentist put me in the chair and go, let's check this properly. And he checked how I was biting on it. He checked my canine guidance. And he said, Natalie, this splint doesn't really fit that well, but I'll adjust it. But if this doesn't work, I think we might need to look at something a bit more in depth with your headaches. And it was that small conversation that I went, oh, okay, maybe I need to put myself as the patient. And so from that, yeah, I went to a dentist who is Steve Olmos trained from the US, Dr. Wally, and he took a CT scan, and all the questions he's asking, I was asking me about sleep, he was asking me about mouth breathing, and all of a sudden I started to go, oh my gosh, all this pain I've had all these years, all these various medical conditions that I've been too embarrassed to tell people because I just thought, oh my gosh, I'm one of those people. It made sense in one consultation. And he took a CT scan and he looked at the screen and went, oh. And I thought, well, that's not good if someone says that. And he said, well, you win the award for the worst scan. I was like, what does that mean? And he said, the damage you've done to your condyles on your TMJ for someone your age is not good. So he explained to me that I was born with a tongue tie. And then from that, I obviously had sleeping issues.
Breathing issues probably.
Yeah, so breathing issues, and then I grind my teeth, which turned into a TMJ issue. But the most interesting part for me was the symptoms he went through. So he didn't, there's the obvious symptoms. Do you wake up with headaches? Are your headaches behind your eyes, in your forehead? I ask patients those questions too. So I'm like, I understand this. But then he asked me, do you have pain in your arms, in your forearms? I was like, well, yeah. I sleep on my arms at night because my arms ache all night. And you have pain
I've never heard of that. I'd love to learn that connection.
Yeah, so, and in your pelvis, you have pain in your pelvis. I'm like, yes, when I stand up, I feel like I'm going to fall apart. He's like, yep, that's all connected. And then he said, do you wake up a lot at night? And I said, well, yeah, my kids finally sleep through the night and I wake up 5-6 times a night to go to the toilet. And he sort of looked at me and I went, oh my gosh, I've got an aspect of sleep disordered breathing. And he said, yeah. I said, but why am I grinding my teeth? Because I could never put that connection together of you mouth breathe and you grind your teeth. And he said to me, your body probably has never entered a deep sleep. So your body is constantly on this sympathetic mode. You don't enter that parasympathetic rest and digest. And so at night, your body is just so stressed and it's trying not to suffocate because you can't breathe. So you're grinding your teeth just because you're so stressed, and your body's not releasing that antidiuretic hormone, so you're getting up to go to the toilet. And he said, if you were 6 years old and a patient said to you, oh, my child wets the bed 6 times a night, you'd go, oh my gosh, that's a problem. But as an adult, waking up to go to the toilet 6 times a night, you just think it's annoying. And I was like, oh my gosh, this all makes sense. So
I think it's so amazing how you've had the training, you work in the dental office, and it's so true for so many of us. We have this disconnect with our own symptoms and ourselves, And you're not the first person, as I've been interviewing people. Melissa had the same story, and she's like a lecturer, educator, and she finally only recently acknowledged this stuff in herself as well. And I don't know why that is. You know, maybe like you said, we're trying to help everyone else first. We don't really think about our own stuff, or maybe it's denial. I have no idea, but it's really common. So I'm glad that you are noticing all these things and that it's coming full circle. And I'd love to know how treatment is going or where you are now too. So finish the story and then tell that.
Oh yeah. So he sort of, you know, that light bulb moment of, okay, I don't sleep. There's a reason behind this. And, you know, at night my mouth is hanging open because I can't breathe. And then I'm grinding my teeth. And it really was for him, he's like, we can't just rush in and do everything for you. You can't rush in and go, okay, great, I'm going to do myofunctional therapy, I'm going to tape my mouth. And he said, because you've got so many puzzle pieces we need to break down. And so of course I was like, wow, I'll go and get my tongue tie released, I'll do and he's like, you can't. He said, we got to work backwards from the damage you've done. So he said, the most important thing at the moment is we need to address what you've done to your TMJ, because I've completely flattened off my left condyle. So that's flat. My right condyle is a bit misshapen. Yeah. And both my discs had dislocated anteriorly. They weren't coming back. So, gosh. And then when you go through the symptoms, you know, what do you wake up with? Oh, I wake up with numb ears, and sometimes half my face is numb. During the day, I get facial tics, and it hurts when I put my hair up because just my head hurts. And you go through all these symptoms, and when you say them, you think, if a patient told me that, you would think, oh my gosh, why have you been walking around like that? But you just put up with it. And I think as a mum as well, I just sort of thought, oh, well, I've had 2 babies, you know, my body's just not what it used to be. And I did say that to the dentist. He's like, you have aching in your arms. How is that related to having babies? Yeah. I was like, oh, I don't know, they're heavy. Yeah. So once he explained the connection and that, you know, I had tinnitus as well that had started to get really bad. So just everything I did, I had this constant ringing in my ears.
Yeah. Can you explain all the aches that you had in your body and, you know, how that relates to the sleep and breathing and other issues?
So with all the aches came back to basically the nerve damage that I'd done in my TMJ. So because I'd been grinding my teeth and my condyles had displaced, that nerve complex, so the trigeminal nerve, that was causing obviously the facial and head pain. The tinnitus was caused because you've got that ligament that sits closely behind where your TMJ and the condyle sits. And so that was being pushed on by my displaced condyles. And so that was causing... that
I've heard about a lot is the ringing in the ears, the tinnitus, and TMJ, discompression, and you know, TMD issues. And so that's good for people to know for sure. But yeah, keep explaining.
And that's saying, because when you can't breathe, you get that forward head posture, and that in that occipital region at the back of your neck. So that occipital region is where your C1 and C2 innervate. And that nerve supply is what runs down your arms. And so if you've got that forward head posture with your mouth hanging open, and then every time you need to swallow, you need to close your mouth, which sort of, you need to close your mouth and push your jaw back to swallow. You're just pushing on all the nerves in those areas. And that's what's causing that pain down your arms. So if you can decompress the TMJ, you still need to have other therapies to help with your posture and your airways, but by decompressing that TMJ complex, you can then release the pressure on that nerve, which then you feel like you can sit up a bit more upright. It helps with that occipital area and you don't get that pain. With the pelvis, that one was the most amazing for me, because when you look back into it, when you're at like sort of the 8 weeks embryo stage, your jaw and your pelvis are actually connected. And then as you grow as a baby, so your TMJ is the start of your spine, your pelvis is the end of your spine. And
Wow.
so if you're out of alignment up the top, it's going to put you out of alignment in your pelvis.
That's amazing. I've learned a bunch of new things today. I'm so excited that we had this interview. That's so cool.
And
it's fascinating and it makes perfect sense.
It was and I went on this, I couldn't stop reading about it. I just had to keep reading, and it changed the way instantly I practiced. So when a patient came in and would say, you know, they fill out their form and they tick yes, they have a headache. And then you start asking questions and, you know, do you have pain in your arms? Do you have pelvis pain? And they sort of look at you like you're crazy. And particularly then when you ask them if they've got digestive issues, because I've always, my whole life had digestive issues. And then people think you're just nuts because you're meant to be looking at
issues. Talk about the connection with that.
So the connection is because you're not, well, you're mouth breathing at night, but because you're not entering that deep sleep, so your body isn't getting a chance to rest. So because the body is basically constant in the flight or fight response. So during the day, your body's, you know, ready to go. At night, my body's not resting. So I'm just had constant, it was ready to go. So even at night, I wasn't entering any deep sleep. So my body couldn't digest and just protect itself from the day before. So I had, you know, systemic inflammation running through my body, which, you know, blood tests showed that I had inflammatory markers in my body, but not anything specific. So there was, that's where the digestive component comes from. If your body can't sleep, it can't relax. Yeah,
and then on top of that, if you are, you know, like a lot of our patients, tongue thrust swallowing, mouth breathing, you're more likely to take in air and, you know, that kind of thing. We know there's connections with sleep sort of breathing and like acid reflux or silent reflux at night. So there's probably a ton of crossover with that. But where are you today? Like where are you on this journey? Like what's better? What's the same? What stage of treatment are you in?
So I had a day splint, so a day TMJ orthotic to realign my occlusion and put my condyles back into place and allow my discs to go back into place. And that all happened quite quickly. So the pain in my arms and pelvis went quite quickly.
Good.
And then I wear a mandibular advancement splint at night. So initially my body pain went quite quickly. My headaches got so much worse. And that's just because as we readjusted where the TMJ was sitting, because like you would all know, if you've got a tongue tie, your body compensates. And then, so my body had compensated all these years, and then I did all this damage to my TMJ. So then my muscles went, oh my gosh, we have to compensate for this damage. And then we were going in and trying to realign things. And my poor muscles just went, what is going on? And so my headaches got a lot worse, but then they got better.
Good.
My sleeping at night, I almost instantly started only waking up once a night once I started wearing the mandibular advancement splint.
Good.
But we still noticed my headaches, they're still there. Once we'd finished sort of the 3-month treatment with the day orthotic, I still had head pain, and so we went to an ENT, an ear, nose and throat specialist, because on the initial CT scan you could see that my turbinates were slightly enlarged and I had a slight deviated septum. So went to an ENT and he put a scope in and he said the initial CT scan sort of didn't show as much as what was happening in my nose. So I do have to have surgery to get my deviated septum fixed and my turbinates reduced and just have my sinuses cleared out. Because I've got chronic sinusitis, even though I didn't have symptoms, but the ENT said sometimes as adults you just put up with things without
Or I mean, if you have
realizing.
headaches so much all the time, you might not
Yeah,
differentiate the sinus pressure, sinus pain from the
the
chronic
headaches.
6 to 8 weeks of headache is a lot.
Yes,
That's a lot. So
they were full on. Yeah. And so I'm waiting for that surgery. It was cancelled because of COVID, but I'm doing a lot better. I think
good.
the interesting thing I found out along the way as well, that people with deviated septums, you're generally not born with a deviated septum, but if your tongue doesn't sit in the roof of your mouth to help shape your nasal cavity, you can
Yeah,
develop a deviated septum, and then the cascade again of
I
turbinates,
know.
and it all goes back to that, being a baby and just checking things properly and
I
getting on
know.
top of it. But
Well, you're such a good example of, and I hate to say it, but so much of what you've been through is avoidable if this stuff is
yes,
addressed in childhood, right? I mean,
yes,
that's why adults, I mean, I love helping adults with all these things, but it's also really kind of disheartening to know that if someone had talked about this stuff early or helped them early, and honestly, for most of us, I mean, myself included, and everyone I've interviewed, we didn't have access to this type of treatment when we were all kids, and there wasn't an understanding of all these things. It's very new.
no,
And so,
yes,
it's hard to say like, oh, if only we could go back in time. But it's true. So I think what we can all do now is really focus on helping the kids and the babies and
yes,
identify this stuff young, right?
definitely. And also, I use doing my functional programs, and I know a lot of hygienists that do think, great, we're all going to treat babies and kids. And then when you go through this yourself, I want to help the adults out there. So, when they sit in your chair and I think I grind my teeth, and to talk to them and go, okay, this is bigger than you grinding your teeth. And once you start breaking it down for patients and they're like, oh my gosh, yes, I haven't slept for ages. And
Yep.
they start to open up to you, and just giving them that avenue to go, it's okay to not feel great, and we can help you feel better. And as a hygienist, I can't do it all. I'm going through some training with another dentist at the moment and a physiotherapist, just to help me understand how to assess patients better and what avenues to send them to, because you need to have that team approach, not just
Totally.
here's a
Yeah.
splint, don't grind your teeth. Like, let's get to the bottom of it.
I'm so happy you're saying that. And that's true. I mean, I totally relate to you. My passion and the patients I want to treat are the adults. Like people like you
Yes.
are the ones that I love working with, because you feel like you get to help them undo so many of these things and solve these mysteries that, nobody else has really been able to connect the dots, just like that dentist connected the dots for you. A lot of times I get to be the person who says, I can't help you with everything, but I know this awesome dentist, and I know you should get a sleep study, and I know you should go see an ENT. Let me help you with that. And at the same time, we can try to undo some of these habits. So I love that you brought that up, because it's easy to focus on, oh, we need to get the kids. But I'm the same as you. I really like working with the adults. So
yeah.
Well, what about one last thing? Why don't you add in, are you having your tongue tie release? Is that in the works? Are you doing myofunctional therapy exercises?
Yes. So at the moment I'm working through my functional therapy, and again, I've hit that wall once I get to the swallowing exercises.
Yeah.
But I have to wait for my ENT surgery so that I can breathe. Because if just those small pieces, we can't go in. If once I've had my ENT surgery, we might find I can do my functional exercises a bit better, because I don't have all that gunk when I'm swallowing, and I can breathe better when I swallow. So I am concentrating on just doing the exercises I can. I'm working a lot on my breathing, because I'm a mouth breather essentially, but I've taught myself to breathe through my nose, but I breathe through my chest. So that causes other myriad of problems with muscles. So it is. So I'm working on teaching myself how to belly breathe, so that once I've had surgery, that's another piece of the puzzle. And then if I need to move forward, I can get a tongue tie release.
Oh my gosh, I'm so glad you shared your story. I know you were like shy and like, oh, I don't
Yes.
know about this, but I knew that, I mean, this kind of story, it's so helpful for other people to hear. So I really appreciate you doing this. And, you know,
Thank
especially
you.
with the time difference and coordinating our schedules, I'm just so happy that you did this. And if you
Thank
need
you.
help, I would be happy to meet with you and do some therapy sessions. So if you want to work through anything with me, let me know.
Great. Thank you.
Yeah.
Yeah,
But
thank you.
otherwise, I mean, I think it sounds like that's pretty good. Do you have anything else you want to add, or should we just wrap it up?
Yeah, no, that's fine.
All right.
Yeah.
Well,
Okay, thank you.
thank you again, and I'll link your, maybe I'll link your dental office website. I
That
know
would
you're
be
not
great. Thank
practicing
you.
myofunctional therapy on your own, but
Yes.
it sounds like you work with some amazing doctors. So if anyone's in
Yes,
Melbourne and they
definitely.
want to link up with you guys, I'll have
Yes.
to get that information from you, and we'll link it to this
Sure.
video because it sounds like you're working with some awesome doctors. So,
Yeah,
all right.
thank you.
Oh
Thank
yeah,
you.
you're welcome.
Thanks.
All right. Well, I'll just see you later. I guess we'll wrap it
Thank
up,
you.
but thank
Okay.
you so much.
You're welcome.
All
Thank
right.
you.
Bye.
Bye. See ya.